is multiple personality disorder. My name is Dr. Jalil Mohammed. I'm a consultant psychiatrist and my job is to diagnose and treat mental health conditions. The first thing to say is that the term multiple personality disorder is quite a misleading term because nobody actually has multiple personalities. The primary symptom in this disorder is that people have periods of dissociation, and during those periods of dissociation, they can take on the characteristics of an alternative personality. A better term for this condition is the term we use in clinical practice, which is dissociative identity disorder. Dissociative identity disorder usually stems from childhood psychological trauma. The vast majority of people, 90+% of people with dissociative identity disorder, have had multiple forms of psychological trauma during their childhood, including physical abuse, sexual abuse, and neglect. During these periods of abuse in childhood, the child's brain may dissociate in order to try to psychologically protect them from what's happening to them. And one type of dissociation in which the brain may try to protect us from what's going on around us is to make us believe that we are someone else, somewhere else, doing something else. And as this progresses over months or years, the person ends up taking on a completely different identity or personality when they dissociate. And so although it may seem like people with dissociative identity disorder have multiple personalities, in fact, the main issue is the underlying dissociation. In terms of treatments, there are no medications which help with the actual underlying issue. Some medications may help with associated symptoms like depression or anxiety. The main treatment is psychotherapy, and psychotherapy can help us to deal with underlying trauma and can help us to develop coping strategies or skills to deal with stressful life events.